kind introduction. So what are the aims today for this workshop, also for my little introductory lecture, is that I will provide you with an overview on the technology and the clinical applications of the new ABCT breast CT scanner. We will show you also some of the examinations that we will have the opportunity to look at it. I will show you how the image acquisition is done. Then, as an additional feature, I will show you the V-Race platform for artificial intelligence and our new upcoming module for using artificial intelligence in spiral breast CT. Finally, at the end, I will give you some information on the workshop itself, what you are asked to do. So it's not just a listening sessions, but you have work to do. And I will give you an idea how you can start with that work and how you can go on a, let's say, a detective journey of understanding what you can do with a breast CT scanner. So, first of all, what are the main components of a breast CT scanner? You see the patient is in prone position, and the spiral breast CT is configuration is that the system rotates around the breast. So in contrast to the whole body, the CT scanner, which rotates along the whole body, it rotates along the breast only. And the main component you can see here, it's the detector. The detector, that yellow part of the schematic view. And this detector is a photon counting detector, so it's the newest technology of detecting X-rays with a very, very high efficiency. Also, it's very small detector pixel size, which is important for the detection of microcalcifications. From the high efficiency of the detector, it is possible to acquire 3D images at high image quality with very, very low dose, acceptable even to screening purposes for breast cancer screening. And it's a true CT scanner, so a Feldkamp-like filter back projection is used for image reconstruction. So there are actually two systems on the market, and you should not get confused with those two systems. On the left-hand side, you see a cone beam CT, which is a little bit an older system, and we are talking today about spiral breast CT. So the ABCT system, which is the only one with a photon counting detector. And the most important difference, apart from the efficiency, bringing those to an acceptable value, is the detector pixel size, which results in a reconstructed voxel size of 0.15 millimeters cubic. And 0.15 millimeters cubic, 150 micrometers, is the size of microcalcification. So that's important. If you don't reach that spatial resolution, you will not be able to reliably detect microcalcifications. And this is what we require of a breast CT system. So about 5 years ago, we got the worldwide first installation of a breast CT scanner at the University Hospital in Zurich. This is how it looks like in reality. What you can already see is that, or what is already mentioned here, is that there are different lengths which you have to adjust. So you give it a scan range, which you want to cover, and the maximum diameter of the breast is 190 millimeters. Actually, these sizes of the breast, they are sufficient for, let's say, examining 99.9% of patients. Almost all patients can be examined with that system. Yeah, so our first patient was examined in the year 2018, and today, up to today, we've examined more than 3,500 patients, mostly for opportunistic screening. So what has to be done for the examination? You have to walk up, as a patient, you have to walk up that small ladder, and then you lie down on the patient table, and there is an opening. The breast must be introduced opening. So how is this done? We call it the superwoman position, one arm up, the other arm down, and the arm which is down, this is the side which you are imaging. So the idea behind that position is that you get as close as possible to the patient table, that you can cover as much as possible from the breast. Yeah, to make it more comfortable, you can make a little cushion below the feet, and also to keep it stable, that there is no patient movement, you can put a little sandbag on the shoulder of the examined breast, and thereby the images will get a little bit better. So this is how the system looks like from inside. The technician looks from the side at the length of the breast. This is important that you don't scan, let's say, a range where there is only air inside. So you look at the length of the breast. This is one of the parameters which you have to fill in later on in the examination card. Again, you see the detector, which is the most important part and also the most expensive part of the CT scan. Here is what the technician has to fill in. Basically, there are only two relevant parameters which you can fill in. The one is the length of the breast, as we said, and the other one is the tube current. So the tube current is not automatically adjusted, but you choose the tube current before the examination. And we at the University Hospital in Zurich, we always use 32 milliampere, which is a good compromise between applied dose and image quality. So, of course, we examine the quality of the images which we receive, first in phantoms, and using a dose between 4 and 6 milligray per breast, you are able to reliably detect microcalcifications and also soft tissue opacities. Also, from our large cohort of patients, we did real Monte Carlo simulations to calculate the dose, and we are able to prove that typical dose values are in the order of 5 to 7 milligray, which is completely acceptable for screening purposes. Also, from our calculations, we are able to give the breast density, and the breast density actually differs very much from what you hear from tomosynthesis or mammography. The breast density, very often you hear that it's in average in the order of 50%. That is by far not true. That's wrong. A wrong assumption in the community, and it results in wrong dose values of the mammography devices. The true breast density is in the order of 7 to 23%. The rest is fatty tissue. So even in dense breasts, it's only about 25% is glandular tissue. The rest is fatty tissue. And this is what something that you can only understand if you're doing 3D to 3D images. So, of course, what you also can do, we mostly use it non-enhanced, so native images for screening purposes. In these patients, I don't want to give iodinated contrast agent, but if there is a problem to solve, let's say there is a clinical question, there is no problem with applying contrast agent, and of course you get then excellent images of, for example, breast cancer. And this is, for example, one of the cases that you can see on the PAC system, and you can appreciate the high quality of the depiction of the breast cancer if you use iodinated contrast agent. Also, it is important to find microcalcifications. The whole system would not be reasonable if it's not possible to reliably detect microcalcifications. And it is possible, and you have example cases on the PAC system here where you can appreciate the quality with which microcalcifications can be depicted. But similar like in tomosynthesis, it might be more difficult to find those microcalcifications because you have so many images. So therefore, it might be helpful to use MIP reconstructions to find those microcalcifications. And this can be done also with this PAC system. You can ask our colleague there if you have problems or if you want to try it. Also, we are in a, I want to introduce you to B-Race, the AI startup which I'm involved from the University Hospital of Zurich. And in that startup we develop solutions for breast cancer detection or breast imaging. So of course our most important modules which we are providing at the moment are modules which are based on mammographies, because more radiologists apply mammographies or tomosynthesis than breast CT at the moment. And our modules are able to cover mammographic breast density based on the ACR BIRADS catalog, so it's not a quantitative one, but it's one with artificial intelligence. It really follows the BIRADS classification of breast density. It gives you also, it shows you also microcalcifications or suspicious soft tissue opacity, so cancer detection is also possible. It also gives you, which is very important for screening purposes, the PGMI criteria for breast quality. So it's a quality control tool which gives you quality data whether your technicians comply with the standards required for breast cancer screening program using mammography. So that is a very, very helpful tool for you for your quality control. And it gives you in a dashboard an overview of all those findings. For example, you are able to find out which sites of your different institutions have the best quality in mammographies, and which technicians, for example, always do systematic errors. But because we are a highly innovative company, we are also investing in new technologies, and we are at the moment developing a module for breast CT. So this is still a prototype. So if you are going to use it, please take into account that it's not finished yet. So we are at the moment developing it, but it gives you an idea of what is possible. At the moment, it will give you the following possibilities. You can look at the segmentation of the breast tissue, which tells you that it's reliable dose values which are calculated. Only if you do segmentation of the glandularity of the glandular tissue, you will get reliable dose values. From this segmentation, it gives you a computation of the mean glandular dose, and it also gives you a percentage of glandularity of breast density. In the future, we will also have modules for tumor detection, and you can also it visualizes the breast CT, which is helpful if you want to look at the images directly at the CT scan. So there are a lot of features, but if you, when you're using it, you find out, I missed something, I want to have this or that feature, you can tell us right now, then we will try to implement it in this new module. So, coming back to the hands-on course, so it's there is work for you to do, as I said, and there is a little textbook here, this textbook, and you can work through the cases based on this textbook, and it always tells you here, let's say, in red, what you should do. It gives you a little bit of a patient history, and it tells you what you should do. So for example, in the first task is that you open up case 1, and you try to look at the images of the first case, breast CT images. And then you can try to get, let's say, MIP reconstructions, whatever, and you can get familiar with the PAC system that you are using. Later on, it will tell you that you could look at an AI evaluation of breast CT or of the corresponding mammography. You can do this in the web browser, which is here installed on your PACS systems. There is the V-Ray solution for image analysis using artificial intelligence. And you can play a little bit around with that system, look whether it reliably detects the breast cancer or not, whether image quality is good or not of the mammography, and you can, if there is a corresponding evaluation from the breast CT, you can look at the breast CT module. In the end, it's 10 cases, and the aim of the workshop is that after 1 hour, you are at case 10, and you've understood everything from breast CT, the PACS monitor, the PACS system, the barcode monitors, and the V-Ray platform that you can use. So that's the aim. So I think now you can start. And we are here to help you with questions or with your answers.